Right, here we go again. My lung problem. It's called pulmonary fibrosis, and that just means scar tissue of the lungs, also known as interstitial lung damage, or ILD for short. Today is the 6th of December 2021. Well, I'm still trying to get over the shock from my visit to the New Packwood Hospital in Cambridge. I've had a few days to try and come to terms with the news, but, and it's a bloody big but, it's difficult because you simply have no idea of what it is and what to do with the best to help yourself manage as best as possible. There are things that I need to try to find out about. Exercise. Bearing in mind, any exercise is going to make you out of breath. But, sorry, does the benefit of doing it outweigh not doing it? What sort of exercise to do? Well, I suppose marathon run is out of the question now, isn't it? Diet. This has never been easy as I'm insulin dependent. Carbohydrates are my enemy, and they're present in most food. The reason the carbohydrates are such a problem is that your body's smart and it converts them to sugar very quickly. And so it spikes your blood sugar. If I have carbs, I have to do some swift maths and work out how much Nova Rapid fast-acting insulin to inject. What a nightmare. Acute kidney disease. My kidney function is 25%. I've lost 75% somewhere. That could be partly down to the error, maybe the overdose of tablets that I got a little while back from the medical centre. Could be. I know I was in Adam Brooks 12 hours being checked to see what damage it had done to my kidneys. That's a good thing, isn't it? Now, the tablets, if I take them, they're going to be a problem for kidney disease. So that's an added issue for me to worry about. What I'm going to try to do is try and keep as many impurities out of my diet as possible. The reasoning is to try and eliminate as much as it is as possible, adding anything that will increase the impurities and so give my kidneys the easiest workload possible. In today's food and meals, there are all kinds of stuff. You read the packaging labels, stuff you've never heard of. Are they a necessity for life or not? Strongly suppose not. So you have to try to eat as much fresh food as possible. The probability still would not eliminate everything, as I'm sure that chemicals that are used on fruit, vegetables, even the so-called organic ones, unless they're grown undercover, they get watered by rain. The rain contains chemicals that is picked up from the ground, and so you get chemicals on your fruit and vegetables, everything grown out in the open. Organic, I ain't too sure about. What I do know about organic is it's bloody expensive. 31st of December, last day of the year. Nothing to celebrate. The only thing that's changed over the past few weeks is I worry more. Well, it's not strictly true that nothing has happened. On Christmas Day, after being up for about an hour, I noticed I had a pain on the right-hand side of my back. Niggly pain, but it was there all the while. The next day, the pain seemed to be shifting slowly round my body towards the ribs on my right-hand side. I thought, Christ, pain shifting from your back round your body. Every day, the pain got worse and it hurt to breathe. Last night, the pain was really bad and I was not able to get to sleep at all. Today, I sent a message down to the doctors and Dr. Gilchrist phoned me almost immediately to discuss the pain. She doesn't think that it's either of my two major problems. So I thanked her for the reassuring call. We agreed to see how things progressed. As I'm sitting here in pain, it's really bad, and I cannot find any way to ease the pain by sitting differently or even trying to breathe differently. Well, the pain slowly eased off and was gone after 13 days. 13 days. What it was? No idea. Bloody glad it's gone, because it was just another additional thing to worry about and an additional pain that I could well do without. Well, it's the 19th of February and there's no cure for my lung condition. According to the New Papworth Hospital, 60% of patients are dead within 3 years of being diagnosed. I remember saying to the doctor, 3 years? Bloody, that's not a long time. The doctor replied, no, not 3 years. It could be 3 months. 3 years that's how long people generally live after being diagnosed. It's a 60% death rate. There's no cure, but there is a tablet that may prolong my life, but it's got side effects. The main one, that is not friendly to your kidneys. And my kidney function's pretty grim anyway, so it's a big concern. Also, another very common side effect is diarrhea. Another much sought after complaint. You'd think, I've pondered over whether I should take the chance with a tablet or not. I've decided after a bit of a mental struggle to go with the tablet, as I've got nothing to lose. Today's the 20th of February. It's about 6:30 in the morning. Another bad night for sleeping. I go to bed about past midnight and generally, with luck, manage to go to sleep pretty quickly. But after an hour or so, I'm awake, and from then on, it's just about lying on one side, that aches, turn over, lie on the other side, that aches, turn over, lie. This goes on all bloody night until I can't stand it anymore and I get up. My mind is full of bad thoughts that just don't go away. And after being in bed, all I've got to show for it is a sore body and a bad headache. I'm sitting here looking at myself recording this, and I'm thinking, bloody hell, it looks as if I've undergone some form of chemotherapy, as I have none or very little hair. Well, I've not. I've been giving myself a haircut for many years. Doreen used to do it, but now I have to manage it myself. And I don't find it easy trying to mow the top of my head with my wild hair trimmer. It's awkward, bloody awkward. I find it. Don't know how other people manage. Well, this time was no different. And after I'd cut my hair, I hoovered up all the hair from the computer desk, went into the bathroom to wash my hair. Now, it did feel a bit strange when I was rubbing the soap through my hair, but there you go. I rinsed it a couple of times, and it wasn't until I dried my hair that I realised I didn't have much of it left. What had happened was that instead of giving myself a number 2 all over, I had somehow managed to miss the step of putting on the black plastic comb. So I'd inadvertently give myself a 0 all over. I think I'm losing the plot as well as my hair. I've been on my tablet now for about a month. It's delivered to my front door by a special messenger from New Papworth Hospital. So far, I've been lucky, really lucky. I have not had any diarrhea, so that's a good thing. How are my kidneys being affected? Well, simply don't know, as I have not been contacted yet for a blood test. I should have one every month to see how my kidneys are faring. Well, I suppose in that respect, no news is good news. So I'm not in a great rush. I'm not in a great rush to volunteer, put my hand up for a blood test. started to cough a bit now, so we're going to leave it there and see how things go. Probably talk to you another day. Okay, bye.